Hi, welcome to Straight Talk. Everyone in this country has been hearing about the heroin epidemic that's going through our communities. It doesn't matter what state you're in, what city you're in. It seems that the heroin problem, the prescription drug problem, is getting worse and worse. On top of it, we talk every day about the legalization of marijuana. Will that increase the use? The drug issue is very, very big, and it's hurting a lot of people. So today on Straight Talk, we're gonna talk about how do we help somebody? What do we need to do to help someone? And joining me for the entire show is Karen Moore, who is a drug counselor, therapist, social worker, a little bit of everything.
Yes.
You've been in the field a while, and you work with this population and have for a long time. Welcome to the show.
Thank you.
I'm glad that you're here. You know, I don't know what you're seeing. You work for the Maryland Addiction Recovery Center,
Yes.
and you're a therapist there. What are you seeing coming in?
Gosh,
Because you've been in the field a while, you've seen changes that have happened. Are you seeing anything different coming in, people looking for help right now?
I mean, a lot of our younger adult population is heroin.
Really?
I mean, hands down, biggest drug that we see come in, people needing outpatient detox, ways to just get off of the drugs.
Young people?
Young
When you say
people.
young, how old are
I'm
you talking about?
Like 18 to 24,
Really?
18 to 25. Very young.
And you're in a very nice middle upper class kind of, we're talking about population.
Oh yeah, the face of addiction has changed. I mean, you know, I think there's a stigma that it's, you know, an inner city problem, right? That the typical addict is going to be the person who's on the street. They maybe hadn't had a lot of resources growing up, but that's not what we're seeing anymore. I mean, the people that come in the door are from middle class, upper middle class families, just not the typical person you would think who might struggle with addiction.
And they're coming in addicted to heroin.
To heroin.
What do they tell you? I mean, you know, when you say, well, how do you get your heroin? Where's that? How did you get started with heroin? You're a nice middle class kid. What do they tell you?
I mean, a lot of them talk about starting with prescription drug use. I mean, that usually is the typical way. A good point of entry, we would say, is it starts there. I think there's been a huge crackdown on the way it's prescribed and regulations in terms of the doctors and what they're able to do. And with that restriction comes, you know, still the demand for this opiate drug that can be found in heroin, which is much cheaper and very easily accessible. And obviously we know in Baltimore it's a huge issue and it's very accessible. So these kids go from a very restricted type of drug to now this widely available and cheaper, you know, thing that does a lot of the same thing, and it's more potent on a lot of levels.
So they'll get prescription drugs, which have obviously been super popular for a while, and now they can't get it, but heroin's cheaper and it's out on the street, so it's almost easier for them to get now.
Yeah, it's
so it's easier to get heroin than it is to get prescription drugs. Boy, that's changed.
That has changed.
Wow. So these kids are now they're doing heroin.
They're doing heroin, and you know, a lot of them will also start doing, you know, intranasally. They'll do it that way, and then that's kind of not good enough, and then they up the ante, and then we see it going into the IV drug use, and that's when you see a lot of destruction, a lot of issues coming up. You know, Hep C becomes an issue, HIV becomes an issue, because people start to not care, and they will do anything for the drug, and they will not worry about the consequences anymore.
So they'll start by snorting it.
Snorting it, correct.
And then eventually they'll use a needle. So these are kids who probably would say, well, I'm snorting, I'm not using a needle.
Correct.
So I'm different.
From different.
But eventually they'll use the needle.
Eventually they'll use the needle, and they, you know, some of them find treatment pretty quickly after that.
Wow. So explain to me when you say they're opiate drugs. What does that actually do to the person?
Basically, the opiate drug, it's a painkiller, right? So it blocks pain. Now, for that person, becomes a way to escape life, to escape problems, to escape emotional pain, to escape anything that is uncomfortable. And that's what the drug then becomes. It becomes a substitute coping skill for how to deal with any type of uncomfortable feeling in their lives. And that's, you know, what's intended for, obviously, is for pain, for someone who has some type of very crippling issue that is so painful that they need help. But these people then use it to heal emotional pain, to deal with feelings, to deal with anything that they come across that does not feel good to them, that they want to escape or avoid.
And eventually they get addicted. They get used to it. They like that feeling.
They like the feeling, and then when they try, if they reduce the amount that they take, then they end up in withdrawal, which is very uncomfortable. They get very sick. They get and then they need more to at least just stay normal sometimes. A lot of times people talk about chasing this high that doesn't exist anymore because they need so much in order to just be well that, they're chasing this elusive first use that hasn't existed a lot of times for years.
So the addict who's doing prescription drugs, is what the drug is doing to the person is the same as heroin does. Mm-hmm. So it's like they'll switch, they can go back and forth. Mm-hmm. So now we've got all these prescription drug addicts now using heroin.
Yes. Who
are out there. So that multiplies, obviously, the number of people, and it's getting younger, more middle class.
Yes. I mean, they talk about it. It's expanding out into counties outside. We think of this as a city issue, but I hear about overdoses in Harford County, in the neighboring counties, in Baltimore County. Like it's going out of the major city, and we're seeing, deaths occur in places where it was kind of unheard of many years ago.
You would never think about it. It's happening all over the country.
All over the country.
In Connecticut, places that they have heroin.
There's substance abuse treatment everywhere because it's so, people will talk about needing treatment and being like, I need to get away from home, but the truth is that, it's everywhere.
It's amazing. It's amazing. Well, this is a good start. I wanted to kind of talk about the heroin, but when we come back, I want to talk about what you do to help somebody.
Sure.
When they come in and say I'm on heroin, what do you do with them?
Okay.
How do we help them? So thank you for getting us started.
Absolutely.
When we come back to Straight Talk, we're going to keep talking with Karen Moore. She's a therapist. She helps people with drug problems. If you know anybody has a drug problem, the Maryland Addiction Recovery Center is there to help you. Karen's there to help you. Give them a call. So when we come back to Straight Talk, we're going to keep talking about heroin and helping people. Stay with us. We're coming right back. Hi, welcome back to Straight Talk. We're talking with Karen Moore, who is a licensed social worker who works with addicts. She works at the Maryland Addiction Recovery Center, and she's helping people get off of drugs. If you know anybody has a drug problem, this is what you want to do. You want to pay attention to what we're talking about. It's very important. We've been talking about heroin, about all the drugs that are out there. People need help, and treatment's the only way we're going to get people off of drugs. So, Karen, thanks for staying with us.
Absolutely.
We talked about the heroin problem. You're seeing it more than ever before. Nice middle-class kids coming in saying, I'm hooked on heroin.
Yep.
Now, what do you do? How do you deal with that as a therapist and a drug counselor? How do we treat that?
So at Maryland Addiction Recovery Center, one of the things we do, we'll often get calls from parents, from the patient themselves, someone actively seeking out treatment, from grandparents, from siblings, from uncles, from aunts, like you name it. Like people just don't know how best to help their loved one get treatment. So the first thing that we do is we'll start with a comprehensive evaluation, mental health, substance abuse, kind of looking at the factors that's going on in this person's life that's contributing to their substance use, what level of use they have, how, depending on the substance, do they need detox? Like just looking at every facet of their addiction and whether, we are an intensive outpatient treatment program, so we make sure that they're suitable for our level of care. Sometimes people need a higher level of care and then might come back to us. But it starts with the evaluation and kind of just getting a glimpse into this person's life and what they're struggling with, and really getting an idea of like how ready they are for treatment and how best to look to help them and what they need.
And that helps you as a therapist, as you say, are they ready?
Yeah.
Are they not? Are they serious? Do you also, when you do this evaluation, do you talk to family members or anyone else? Because who knows if they're telling you the truth?
Oh yeah, a lot of times like parents will come in, or a husband or a wife, or someone will be there, and yes, we'll usually pull them in and someone will talk to them separately, or we'll talk to them together, because you don't always know when they're telling the truth.
Right.
And then some people are very reluctant to have their families involved. They don't want their secrets getting out. They want to keep things under wraps because a lot of times they want to protect that addiction. So families are so important to have there because it's a family disease. That's been shown that the treatment has to include the family is what we think is so important. And so, yes, we want to have the families involved.
So now you've got this picture, right? Now you've got his story, the addict story, and the family. Now you as a therapist, you've got to put it all together and come up with a plan.
Absolutely.
I would imagine, like something to talk. So how do you do that? I mean, what do you have to sit down with him and say, okay, look, here's what I heard and here's what I think's good for you?
Yeah, I mean, after the evaluation, I mean, you know, like I said, we determine level of care. If it's appropriate for our treatment center, we have, you know, 4 days a week in the daytime or 3 days a week in the evening time, 3 hours each, and determine, you know, kind of what's the best level of care for them and how much they need. You know, individual therapy is big. Family therapy, finding out how many sessions do we need, you know? Do you need a ton of family therapy, or are they so enmeshed with their family that they need to be separated and learn some independence and individuation from their family? You know, it's so individualized because everyone presents with different issues. Some people are detached from their families, some people are too attached to their families. And so we kind of tailor a treatment to best suit the dynamics of both the patient and their family. I don't believe addiction can be, you know, really helped unless you're including all the important people who are necessary for treatment.
And that's the therapist's job. That's your job. I mean, you've got, you know, you've got to piece this together and come up with some
It's like a
plan.
giant puzzle.
Yeah, and then sit down with them and hope that they do what you want them to do.
I know, that's the hardest thing, right? I mean, how hard is it for us to change, you know? And we're taking someone who is so ingrained in this addiction that it's almost like, you know, they have this other personality, right? So you're trying to get through that addict brain into the true person and get them to really hear you. And it can be really hard, and you have to have a lot of patience because addiction is so pervasive, and it challenges and changes the way we think, the way they behave, you know, and you have to kind of get through that in order to get through to them. And it takes time, which is why I'm also a huge believer in long-term treatment, because the addiction didn't form overnight. So we can't assume that, you know, in a lot of times 28-day treatment, it's like, okay, they're going to go in 28 days and they're cured and they're great. And it just doesn't work like that.
You hear that all the time.
All the time.
Especially celebrities.
Yes.
They'll go in, then they'll go on the Tonight Show. Oh, yeah, I was in treatment for 30 days and now I'm cured or whatever.
It just doesn't, it doesn't happen like that, you know?
Process.
28 days is just, you know, scraping the surface on usually a lot of years of deeper issues that are very ingrained.
Yeah. Now, we've always heard, like you said, the 28-day program, and when we hear about those programs, and you talked about a Maryland Addiction, you have a day program, a night program, several days a week. It's outpatient, so they don't have to live there.
No, they don't have to live there. So it's outpatient. Yes, it's you know, they stay in the community. We try to work with them to get jobs, to actually start to be a, you know, a part of society that's actively participating and contributing and not taking.
But the treatment is a lot. I mean, you said 3 or 4 days a week. That's hour-wise, it's probably as much as they would get if they were living in a place.
Absolutely. I mean, it's really intensive, and we really focus on, you know, in those 3 hours of really getting people to look at themselves and really getting them to explore their, you know, the inner workings of their mind that feeds that addiction.
Yeah, and that's got to be, is it done in a group or individual?
The IOP, the actual, you know, 3 hours, 4 days a week, or in the evening, 3 days a week is done in a group, and then they usually have individual weekly for an hour.
And then you said the families.
And then family sessions, you know, sometimes once a month, sometimes every other week, just depending on what they need.
It takes a lot of work.
It's a lot of work.
On both parts. Yours as the therapist and the family. It's not, like you said, it's not easy.
It's not easy. No, you have to be on, you know, all the time.
Yeah.
So
it sounds so scary, you know, because these are people's lives that are, I mean, they're one little bit of drug away from dying.
Absolutely. That's the hardest thing with the families, of like setting limits and like learning how to not enable the addiction and not be scared that your loved one's going to end up, you know, harming themselves.
It's scary. We're talking with Karen Moore, a therapist with the Maryland Addiction Recovery Center. We're learning about not only the problem of drug and alcohol, but what she does and what therapists do to help people, and the important role of the family. And we're going to talk more about that when we come back from a short break. So stay with us. We're coming right back to Straight Talk. Hi, welcome back to Straight Talk. We're talking with Karen Moore, who is a drug and alcohol therapist, counselor at the Maryland Addiction Recovery Center. She works with addicts of all ages, young, older, all different drugs. We've been talking a lot about heroin, but there's other drug problems out there too.
Yes, there are.
Certainly alcohol and, you know, the whole marijuana business right now, we don't know what's going to happen.
No, we have no idea.
I mean,
lots of our younger folks ask some questions about what does it mean for my treatment if it's legalized?
I know, it's got to be really weird because the kids are getting a message that marijuana is safe, doesn't cause any problems. You're on the other end seeing people where marijuana probably did cause problems.
Absolutely.
And it's not as safe, but no one seems to want to hear that.
No, I mean, it's really interesting. It creates such a sort of trouble in the addiction world of like, is this drug now okay? And in the minds of our younger population, you know, they really struggle with that. Like, well, you know, society's kind of telling us now it's legal, so, or it's going to, you know, it's moving towards that direction, and that's something I think we're going to contend with in the future in terms of addiction treatment.
I mean, do you see kids coming into treatment for marijuana?
Sometimes, you know, solely for marijuana, mostly for, you know, getting charges for distribution or mixing things or, you know, but for the most part, a lot of them actively use it in addition to other substances. So that becomes their.
And I think that's a part that's never talked about, you know, because they'll sit there and isolate marijuana and say, well, it's this or it's that. But very rare do people they might even just drink with it, or they might take something else, some pills or something, but they usually mix it.
And we find that, you know, some of the people struggling with addiction, they will drop, you know, one substance and then be like, well, marijuana is safer. And then all of a sudden their THC levels are just, you know, going through the roof. And, you know, they don't see that as much of an issue because the consequences aren't as you know, in the forefront as, say, a heroin addict or someone who's drinking and blacking out and not remembering things.
And certainly, as you said, they're getting a message from our society and our government and everyone that, hey, this is probably okay, much like alcohol. That, you know, and they said, well, we'll keep it out of the hands of kids. And I would bet that probably 100% of the kids that see you drink. You know, and they're not of age. So that's not an issue. We could talk about this all day. I mean, it's just it's a scary thing, and we will talk more about it as time goes on. But I wanted to talk a little bit about relapse. People that go to drug treatment, you know, people always say, treatment doesn't work. It doesn't work. I had a cousin that used, you know, that went into treatment and he was using a week later. And there's a famous baseball player right now, this Josh Hamilton, plays for California. He was you know, he'd been suspended for drugs, came back, won most valuable player, signed a big contract, and he just relapsed again. So when we talk about relapse and people that were clean and they use, it sounds like it's a tough thing to beat.
I mean, it's very tough. Like, you know, I think one of the hardest things our clients have is that addiction is it's very much ingrained in the mind, the spirit, the body, everything, every part of you, you know, is kind of inextricably linked with this addiction, and that it kind of takes ongoing work for a really long time. You know, like we often say lifelong treatment, in the sense of like you're kind of always having to look at yourself and work on things and keep your perspective healthy. And sometimes people stop doing that work. You know, they stop, you know, maybe it's 12-step that they go to and they're really active in meetings for several years, and all of a sudden they're like, you know, I don't really need that anymore. Let me just drop that too. Or they exercise too, and oh, I don't really need that anymore. And all of a sudden they're kind of left with this emptiness that festers and then relapse.
And that's exactly, that's a really good explanation, because that's what it is. It's emptiness that they were filling with something that was keeping them clean. And I guess, do they get a false sense that I'm okay now?
Oh, yeah.
Is that what happens?
I'll hear that 3 months in. I got this, Karen. I got this. I'm doing so good. I feel so good. Everything's great. And then you can even watch, even just in that short time, some of my clients like then struggle with that desperation that they once had. They don't stay green in terms of looking at their addiction as something that could creep in at any point, and they do. They get a little bit of the ego, the recovery ego.
I don't think I need to come in as much.
Right. Oh yeah. They start to
wanting
pull
to
out.
back off.
Even 2 months in, like I think I've gotten a lot out of this. It's not helping me as much. I feel pretty good, but they don't realize that like this is going to be something that you're going to have to work on for probably your whole life to really stay in that recovery mindset and to not fall back into using external things to feel good.
So somebody who's went through treatment like this baseball player, was clean for a while, very successful again in his career, and then all of a sudden out of nowhere, he signed like this huge contract, and next thing you know, he's using again.
Yeah, and I mean, I can guarantee you, I bet that sign of relapse, usually they talk about, I mean, it's very classic in the addiction world, they talk about the relapse occurs well before they actually pick up the drug or the drink. So there was probably things going on, if I was just, you know, just assuming, I guess, that there was probably a lot going on in his life prior to this actual relapse before, like something, I don't know what, something had probably shifted. And, you know, usually the thinking and the obsessive and all that kind of stuff will start to surface
Come back again. So that ego comes back. Wow, it's amazing. It's amazing to see. We only got a minute left. If somebody's out there, they're struggling, they know somebody, what should they do?
Don't be scared to ask for help. I mean, there's such a stigma attached to addiction, but the truth is it touches everyone's life. You know, everyone has someone, they know someone, like don't be scared to ask for help. I mean, there is another side and recovery can be beautiful and I watch it happen every single day for people. And, you know, people are doing things and people, you know, some of these people with addiction are amazing people when they get into recovery. They do amazing work. They are the thing that they always wanted to be.
Right. Once you get rid of the drug, get out of the system. Maryland Addiction Recovery Center, we just had their website up. You're there doing great work. They're doing great work. You know, we're just really happy that they're around. But somebody needs to call, you got to call somebody.
Yeah, call someone, call for help.
Anybody,
call
just
us,
call for
we'll
help.
help you. Even if we aren't the right place,
and you've
we'll
always got
help
AA, NA meetings. You got something to do, but not.
Don't stay in hiding.
Yeah, don't do nothing. You know, Karen, thank you so much.
You're welcome.
It was great. Great information. I hope all of you listened to what Karen Moore said about getting help, because if you know somebody who has a problem with alcohol or drugs, or you're struggling, pick up the phone, get some help. You know, that's what it's all about, and there are people there to help you. So I want to thank Karen for being on the show. Thank you for watching, and we'll see you next time on Straight Talk.